when you set up your transducer, have it zeroed, this is the waveform that you're going to get off your patient. They don't always look exactly like this. There's 3 things you want to look for. You want to look for the 3 humps on your ICP monitor. The first hump is the tallest hump. Then you have a second middle hump, and then you generally have a third hump. Normal ICP is anywhere from 5 to 15, depending on what book you read. Those are kind of the key things with the waveform of the ICP. If your waveform right here resembles a middle finger gesture, that means your brain is not compliant with the blood that it is receiving, and that is a call to the doctor to inform them. So let's talk about drainage based on your ICP. Here's the disclaimer. What I'm going to talk about is for continuous drainage, that is only for the ICU critical care areas. So, in this case, this patient ICP is 28, so we need to drain. Briefly, our EVD drain was set to 12, so I need to open my drain and continuously watch the drips for a prescribed amount of time that will be set by the doctor. So let's talk about that. So I have my ICP waveform, I have 28. When I go to set up for the continuous drainage, again, I have my level to 12 millimeters of mercury because that is what my order said. I'm going then to take my stopcock right here, and if I'm monitoring my patient, which I am now where the stopcock is, so again, drain is in my patient's head, I'm following my drain, I see my lever off to the drain, onto transducer. So I need to open the drain. What I'm going to do is I'm going to flip my stopcock this way to drain into my burette. So once I open my drain, my waveform is going to go flat, and that's totally expected. And it may give you a number up here. The number we're not going to pay attention to because we're open to drain. Again, continuous drainage. What your drainage is going to look like now that you're open to drain is you're going to see drops coming from the drain to your patient. Now, what you have to pay attention to is how quick. So if it's shooting out like this, you really need to clamp your drain immediately so that not too much drains out at once, because we don't want that. But if you have a nice, slow, steady drip, watch it until you get to the prescribed amount of drainage set by your physician. In this case, we're going to just let it drain to about here. The other type of drainage order that for the rest of the house that's not critical care, but critical care can do it as well, is what we call intermittent drainage. So intermittent drainage is a little bit different. In continuous drainage, you have your order set to your millimeters of mercury, in this case 12. For intermittent drainage, we're actually going to take the burette and we're going to untwist right here, and we're going to set it 5 below what the order is. So in this case, 12 minus 5 is 7. So what this is signifying is once your ICP hits 12, if you're on intermittent drainage, you're never going to get below 12. And we do want it to drain a little bit so that we don't go over. We want to try to hit that sweet spot at 12. After draining to your prescribed level by your physician, you're going to clamp your drain by turning your stopcock off to the drain.